Hello, everybody. My name is Brock Lindsey, and I'm an orthopedic surgeon here at WVU. I've been here for over a decade. I have both a clinical practice as an orthopedic oncologist and a basic science research lab. I've been doing research in immunotherapy using a nanoparticle delivery method and immunodiagnostics. To give you an example of the kind of research we're doing, specifically using a model of metastatic osteosarcoma, which is one of the rare pediatric disease cancers that I treat, I'd like to show you a few slides. So looking at our clinical problem, which is metastatic osteosarcoma, there hasn't been changes in this treatment for many years. It doesn't care how good of a surgeon I am, as this is a patient of mine who I took out their entire femur. However, they still went on to metastasize and pass away. This disease is severely pleomorphic, so there's no one thing that we could target. And it's an orphan disease, so it's tough to see a bunch of patients in order to try to treat this appropriately. So the problems I need to solve with this, and the problems I'm looking for help in solving, is creating a systemic immunosurveillance mechanism. And really, what that means is to be able to assess where the patient is immunologically, and then how do we fix that? Neutralizing the immunosuppression that we know occurs in malignancy, which is also a newer concept. But what I've noted is that with many of my clinical patients, that just stopping the immunosuppression doesn't really cure the cancer. And then increasing the immune response. So not only do we have to get them back to baseline, but we also have to get them beyond that. And so how do we try to systemically stimulate the immune system to the point where it is kind of the perfect porridge, or just the right amount for treatment of this cancer, and then create a disease of a chronic condition out of cancer where we win the war of attrition. So when you look at the immune system, we have our ups and downs every day. Anybody who has allergies know at that point your immune system is over responding to something, and it becomes hypersensitive. And then we also have the immunosuppression that occurs, that we know that occurs from a malignancy, and we know that it has this ebbs and flow, but all within normal. So what we're trying to do is redefine this theory. Right? So we're trying to look at the immunosuppression that occurs over the time of malignancy. We're trying to take what historical immunostimulation was either way too much, or bottoms out and crashes the system. What we're trying to do is dial in this immunostimulation at a supernormal but therapeutic level and create a chronic immunostimulation over time that can be tolerated and in good efficacy as far as the treatment mechanism goes. So what we've done over the years is we've created a nanoparticle delivery system that delivers immunostimulatory therapy in the form of cytokines. And here are some pictures of the nanoparticles that we're creating, the labeling of them, and then us injecting them in mice, and then getting systemic, and then hitting the specific target organs of the bones and the lungs for metastatic osteosarcoma. All the different elution profiles and size distributions have all been we've done over the years. As far as the immunodiagnostics, we use technology called spectral flow cytometry. What this is flow cytometry kind of on steroids. When you look at it, it allows us to create massive platforms to look at all sorts of cell types, as well as their activation and exhaustion status all at once. We actually were able to do this on less than 150 microliters of blood, which is the same as a finger stick. So being able to do this high-level diagnostic is very advantageous when we look at immunotherapies and the immune response to cancer as well. So we have a model system that we've created for metastatic osteosarcoma in mice, which essentially allows us to create IVIS imaging, or in vivo imaging, to watch these tumor cells grow and metastasize. And this directly mimics the human disease process. So when you look, this is a picture of a mouse that had an initial tumor that went on to metastasize. And over here, you can see the immunodiagnostics component to show, compared to a normal mouse, what a diseased mouse looks like. And you can see the natural killer cell numbers go down, the helper T cell numbers, the cytotoxic T cell numbers, and several of the myeloid numbers are very, very different. Now, in a mouse who had a tumor in their leg that then underwent a surgical amputation and then cured the animal, you could see where all of these same diagnostics end up normalizing. So this gives us a way to track disease progression or disease cure using this immunosurveillance mechanism. So what we did is we went back to our nanoparticle delivery method, made all sorts of modifications in order to try to improve the delivery of this immunotherapy over time. And what we were able to do is get a lot better at creating these nanoparticles, as you can see. So one of the methods we use is sonication, which we're very happy with currently, and we're doing multiple studies on these specific particles. So what we did is we went back to our mouse model that we had published about, and we went ahead and tried to effectuate change in this mouse model. And basically what we were able to show is that a little bit of this stuff goes a long way when delivered appropriately. And we were able to actually do specific cure rates as high as 75% using this nanoparticle delivery, and being able to immunologically see it occur with time. So this is kind of the crux of our research project here in the Department of Orthopedics for our research lab. As far as our mentoring style, I like guided independence as a mentoring style. And by that, I mean, we want students that are, energetic and being able to drive their thought processes into something they're passionate about. As long as they fall under the motifs of nanoparticles, immunotherapy, cancer treatment, and immunodiagnostics, we're here to support that student in their independent passion for what they really want to try to look at. The one specific thing that's great with our lab in particular is one that's highly translational. We have patients that we utilize for research projects regularly. We have a substantial amount of infrastructure, including lab manager that helps with basic science and in vivo studies as far as surgical help and help with patients. We have a non-tenure track PhD that does a tremendous amount of work in the flow cytometry mechanisms. We have orthopedic research residents that help with the in vivo studies as well. So it takes a village, as everybody knows. The lab environment in general for the musculoskeletal research lab, which I happen to be the director of as well, is a multi-PI lab, so very eclectic atmosphere. You have all sorts of different levels of training, from undergraduates all the way through postdoctoral fellows, and even orthopedic surgery residents in the mix as well. So in the end, we're looking for energetic, independent people who are excited about doing big things in research, specifically in the fields of nanoparticles, immunotherapy for cancer, and immunodiagnostics. I look forward to seeing you guys all on campus, and I would love to sit down with you guys to see if you would be an excellent fit, both I for you and you for me, as far as doing research in the Department of Orthopedics. Again, welcome, and look forward to talking to you soon.